Hello, members of the Montgomery College community, faculty, staff, students, and all interested parties. Welcome to our fifth conversation with leadership. And of course, I'm joined by four of my favorite people at Montgomery College, our senior vice presidents, Dr. Monica Brown from Student Affairs, Dr. Sanjay Rai from Academic Affairs, Ms. Donna Schena from Administrative and Fiscal Services, and Mr. David Sears from Advancement and Community Engagement. I'm so fortunate to have them here with me because we are just short of a full year in structured remote status and coming in for a lot of different changes that are going to take place. And I hope many of you were able to see my memo last week announcing our plans for the summer and fall. In case you don't recall the details, let me sketch out the big picture a bit, and then we can get to some details. As you know, the college must plan early for class schedules for the upcoming semester. In fact, they began months in advance of the actual delivery. Most of our work centers around student learning, so making decisions early about how our classes will be offered is critical. Because it's also practical and respectful of complex factors such as COVID, we need to make sure that our students and our employees can make decisions about caring for their children and other family members. And instructors need to make decisions about how best to approach their content and their courses and any special training they may need in order to deliver it in different formats. For these reasons, the college announced last week that we plan to offer the 2021 summer and fall session classes primarily in structured remote format or through distance learning. Now, most of you are very familiar with the remote concept because that's what we've been doing for a year. Distance learning, and for those of you who don't know that term, it means that we're entirely online. You probably know that if your classes are in that category, what that means for you. Now, faculty and staff will continue with their existing remote work schedules unless otherwise noted and informed by their supervisors. There will be some exceptions for a few classes which rely heavily on a hands-on experience for those students. Many of them are sciences, but there are also art courses, for example, that just can't be entirely mastered without some practical experience. So look for the lab next to the course for the possibility of an in-person element. Now, we'll learn more about that in just a moment, and we're going to answer a lot of questions in that space. But I want to get to something I think is really important. Several of you have asked, so you may be wondering, how was this decision made, and how will the college decide on any changes? Now, by now, if you're associated with Montgomery College, you have heard about our coronavirus advisory team, which has been advising my senior leadership team about the science behind the pandemic. This team has been looking closely at a collection of metrics which convey something about the safety of return to face-to-face operations. When taken together, they measure the balance of COVID infection spread and mitigation, including vaccination. You can see in this video that as infections go up, we could tend toward distancing. And as they go down, that would incline us to more face-to-face. Vaccines are the opposite, of course, because the more of us who are vaccinated, the safer it is to hold face-to-face teaching, learning, and working. What I like about this seesaw that it is dynamic. We all know from the past year that these metrics can change quickly, and we have to be able to pivot in response to them. Now, some of these trends we have little control over. Infection rates in the county, for example. Our hands are tied in terms of vaccines as well. And I know many of you want to get vaccinated, but the supply is not adequate yet, and many of us are simply not eligible. Obviously, we continue to track MC's reports of COVID among our students and employees, and those will be factors in how safe conditions are for return. We have not had a lot of folks back on campuses, so these numbers are fortunately pretty low for the most part, but we have seen other institutions that have headed back to face-to-face or in-person learning and then have had to retreat. The University of Maryland College Park had to do that just recently. So we'll be keeping an eye on these, but we'll also be looking at some other metrics such as COVID-19 infections in Montgomery County, new confirmed cases per 100,000 by county metrics, a test positivity rate in Montgomery County by county metrics, a percentage of Montgomery County residents fully vaccinated by county metrics, Montgomery College's case tracking and outbreak data measured by the MC Public Safety Area. Adequate labor and materials for cleaning and disinfecting as defined by our AFS area per CDC guidelines. Sufficient preparation for MC campuses, buildings, and facilities as defined by our AFS area per CDC guidelines. On-site compliance with behavioral protocols as reported by MC's public safety, and MC emergency response planning and teams operational capacity. Now, we'll be updating these on the website each week beginning in June so that folks can see how we're making decisions. And I'm so proud of the structure that we've designed. It includes input from all areas of the college and conveys a lot of information about our readiness at different levels. A few of these metrics I'm going to ask the senior vice presidents to respond to and talk about since they're closely tied to the supplies, workforce capacity, and planning. And I'll turn to them in just a moment. But I wanted to point out two variables that we do have some control over. One is compliance with behavioral protocols. The more robust our education campaign is about those, the better returns we'll see. Education will be key to vaccination, which is the second variable upon which we have control. It may not be mandatory, and it will not be, of course, but the more of us who have it, the less likely we'll be to spread the infection. So we'll likely be launching some public education around that or borrowing some of the counties in this space. Now, we had a lot of questions that came in, some video, some face in writing. So we're going to go to those questions in the audience. And I want to thank you all. It was great seeing people's faces. It was great to see the active engagement. And I'm hopeful that you will be leave this time more informed and more engaged around the issues. The active engagement. And I'm hopeful that you will be leave this time more informed and more engaged around the issues. And I also want to thank the students who participated. Now, the first question that we have is from Jaime Cordova.
Knowing that many people don't show any symptoms, a COVID test will be required for all the students before going back to campus.
Thank you, Jaime, for the question. The college will not be testing students or employees. We simply don't have the capacity for that as an organization, but we will encourage folks to get tested as they have symptoms or they think they may have been exposed. I'm hopeful that you have seen a number of the weekly messages that I put out where I actually direct college employees and students to the abundance of county testing facilities. What we will be asking every person to do, though, when they come on campus is to fill out a COVID-19 assessment before they come to the campus, and it will advise them whether they should reconsider visiting the campus that day. The CAT has designed this checklist very carefully, and we think it's a very good way of reminding people they really need to be careful about interacting with others if they have symptoms or have been near someone who is symptomatic or tested positive. Now, on a related note, obviously, vaccines are drawing a lot of interest, and we had about 5 questions about them. So we're going to shorten them some, and then where they overlap, you'll see some begin to condense those. So I'm going to address them one by one now. One of our colleagues, Pallavi Roy, asked, most likely some employees will not want to receive the vaccine, even if it is reopening. Pallavi, I thank you for the question because it's one that figures a lot in my mind, actually keeps me up at night quite frequently. No one at the college will be required to take the vaccine. We're not able to do that. However, the college will be safer and our communities healthier the more people take it. The virus will have less of a chance to get a foothold if we're able to have as many members of our community vaccinated. Now, as an institution of higher education, I'd like us to be in a place where people feel they can ask questions about the vaccine. We have some highly accomplished faculty and staff who understand vaccines, so you'll probably be seeing programming about that as well. But I think critical thinking is really an exercise we want to encourage within the college community. I can understand the hesitancy, but I plan to take the vaccine myself, and I'm going to encourage my family to do so. I spent a good amount of time over the phone over the last couple of weeks with my father, encouraging him and supporting him as he went through the process of getting the vaccine. And I understand certain communities have different levels of trust as it relates to vaccines and the historical and sociological impacts of what that has meant. If you saw my conversation with Montgomery County Health Officer Dr. Travis Gales a month ago, by the way, he was on 60 Minutes this past Sunday. You may recall I put the same question to him. And his answer, I think, was a good one, Pallavi, that I'm going to try to go by. Encourage people to talk about what's behind their hesitancy. It might be their experiences with the medical profession. It might be a distrust of government operations. There are many reasons why. What's important is to separate the legitimate issues and concerns from those that are based on misinformation. My hope is that the more information we get out there, the more folks will see the wisdom of getting vaccinated. Now, the next question came from Selah Reem. And will vaccines be required for students who will be on campus in the fall? My second question is it likely that all science courses with labs will be face-to-face on campus in the fall semester? So no, students will not be required to be vaccinated to attend classes in the fall. But we do hope and we strongly encourage students, if they're eligible to be vaccinated, seriously and strongly consider doing so. Last week, we had a new vaccine ambassadors program that was started, and I'm hopeful that they will take the opportunity to continue to educate students about the vaccine's efficacy and help with any questions that may be out there about how it works. To your question about labs, I'm going to want you to know that's being worked on right now. Very, when I say robust conversations, but I'm going to ask Dr. Rai if you want to take a hand in talking a little bit more specifically about this, as I know your area has led much of the work in this space.
Thank you, Dr. Pollard. Again, Saleh, all this will depend on the risk level in fall semester. At this time, we are prepared to teach all our lab classes in the remote format. If conditions improve, we will see which labs and how many of those labs can come to a campus. So at this time, we don't know. We do intend to look at the issue and see what can be done based on the ground conditions in August, September. We may start in SRT format, but maybe in late October, if things are better, we may be able to do some labs in person. But at this time, we are just prepared for all flexibility, but we have not made any decision.
Thank you, Dr. Rai. I'm going to go to the next question who came from Sue Adler, and it was, has the college been approached by the county, or has the college offered to be a site for vaccine distribution? Now, I'll tell you that we're recording this on Tuesday, the Thursday before this is actually going to be seen, and many things may change between now and then, but I will tell you that the college has been approached by the county to serve as a state hosting site, and we are in the process of working through the logistics of that if we can get this sorted out, and really would be honored to serve our community in this space. There seems to be a lot of energy, excuse me, around standing up one of these sites in the county. And I imagine that there are a lot of good candidates and locations being looked at. So we'll keep our eye open as to how that's evolving. But to be sure, the college always stands ready to support this work in our community. But I should also mention that even if the college does eventually end up hosting a site, it does not mean that Montgomery College employees or students will be given any preferential treatment in terms of eligibility or access. In fact, we would simply be opening up our campus facility to allow for another entity to come in and to then be able to provide those vaccinations. Our employees and students will still need to fit into the eligibility required to receive the vaccine at a site on one of our campuses if we are able to do that. That said, there does appear to be some movement in the area of employees. I'm sure that you saw a memo this week from HR STEM directing eligible employees about how to request an employee verification letter. So the county is at least anticipating a time when those letters of employment could help people get access. Ms. Schena, do you have any more you want to add to that?
No, Dr. Pollard, we're all over this and paying very close attention to what's happening in the community related to vaccinations, and HR STEM has been monitoring this since a lot of the conversation about vaccine has come up.
Yeah, Thank you. I again continue to be grateful to the team of people we work with, because not only are they doing, in many cases, their day-to-day work that they would do if we didn't have a pandemic, they're also addressing all of the pandemic-related implications. And we're also serving as liaisons to a number of county and state entities. And then last but not least, planning for what a college may look like after we have passed this particular moment. So there's a lot going on, and we work with some exceptional colleagues who are doing tremendous work. So I hope our students and employees know that. Amy Crowley asked the next question, which I think is a great one. When will employees be able to return to their office to work? If employees have received the COVID-19 vaccination, will this allow them to return any sooner? Amy, I love this question because I know you're constantly in a state of thinking about how to be responsive to the work that you have. The return to work date is going to depend on several variables, but whether or not an employee is vaccinated will not be one of them. We'll be looking at all of the metrics that contribute to a healthy work environment that I listed at the top of this particular session. And as I mentioned, things like how many people on campus are reporting infection, the availability of the vaccine in the county, and how prepared our buildings and personnel are to handle folks coming back will all be factors at this particular point. We also know that we will have a staggered approach in terms of how we eventually return employees and students to any type of face-to-face work. So it's going to be a little bit of time. Know that we're in the process of developing that, but those metrics are going to be the guiding philosophy, with a lot of deep communication that I think we've been trying to do very well within the college community. Our next question comes from Rita Kronitis, and good to see your name here. I know the college requested information from faculty and staff a while back. Is there a definite plan in place now for compromised immunity faculty and staff when we return for face-to-face classes? I think I'll turn this question over to Donna. And Donna, you want to respond?
Sure, absolutely. Thank you for your question, Professor Kronitis. I'm sure this is a question others are interested in understanding as well. Since the point in time the medical community understood and communicated the vulnerabilities associated with this virus, our HR team has had a process in place for our employees. Throughout the past year, HR STEM has received and continues to receive notifications from employees who identify themselves as vulnerable. But given the privacy requirement related to individuals' personal and health information, these matters must be addressed individually. The accommodations will vary based on the individual circumstances and the needs of the employee. As employees are notified about their return to working on site, they will also be reminded of the notification process for vulnerable populations. And should they believe they fall into that category at that time, they will need to follow that process working with our HR STEM staff.
So Donna, it sounds like this process is not, we can't have one universal answer to this, because based on the vulnerabilities and the accommodations needed, there are a multitude of different variables that go into that. Is that a fair way of saying that?
Absolutely. It depends on the category of vulnerability and the unique needs of the employee. So we will work very closely on an individual basis with the employees who identify themselves with a vulnerability.
Thank you. Donna, I'm going to tag you on the next question in just a moment, and it comes from Christopher Saka. I wanted to know the protocols in place for an in-person return. What measures will be taking place if a student tests positive for COVID-19? Donna?
Thank you, Christopher, for your question. Yeah. Currently, as Dr. Pollard has indicated, we do have a few classes on campus, and we have some employees on campus. And there is an approval process in place for anyone who wants to access college facilities during this time. But we're only 2 weeks away from being a year in working in this remote operation. It's just really hard to believe. But since operating in emergency remote, I wanted to share with you some data. We've had 24 individuals that were in our facilities or on a campus that have been diagnosed with COVID during the past 12 months. There have also been reports of cases that turned out to be negative. They were not positive. But of the 24 cases that were positive, 20 contracted the virus off campus. 3, it's unknown where they contracted the virus. And 1 was possibly on campus, but that has not been confirmed. There has been no incident spread of the virus at the college resulting from these cases. It has been our rapid response process of a reported case that we attribute to preventing the spread of the virus. There is a very prescribed process when a potential case is reported. We essentially treat every reported case as a positive because we don't know until we get the information back. So everything's just treated as it's a positive. All areas where an individual may have been are immediately isolated and disinfected according to the Centers for Disease Control and Prevention guidelines. Individuals that may have been in the area are notified and asked and to be tested again for COVID. If a case is reported in a class, we've had classes postponed for 2 weeks, or they move to remote instruction. So there will be there's a protocol now for employees and students, and we will make sure that information gets out to the students if they feel they are positive, they've been on campus, where to go to get assistance for that, and then we follow up within the space where the positivity showed up.
Thank you for that. There is indeed a series of protocols we've developed, and I think I'm very proud of that because I believe that we sat down systematically up front and thought deeply about how to keep our employees and students safe, and I'm very, very pleased with what we've been able to do thus far. If you think about this is a virus that has attacked our community, our globe, for over a year. And what we've been seeing in terms of what has happened at the college has been miraculous in a lot of ways. Christopher had a second question. So Dr. I'm going to ask you to respond to it. Will there be the same number of online classes or courses available during the fall semester?
So Christopher, thank you for your question. And I'm assuming when you say same number, you are talking about fall of 2020. So fall of 2020, we offered about 3,700 sections. 3,700 sections, and out of these, about 2,400 were what we call structured remote. About 500 was distance sections, and about 600 were labs. As you know, in fall 2020, risk level was high, and everything, pretty much everything was in the online format, except a very few labs, just handful of labs were on campus. So if this risk level changes and goes, let's say, from high to high moderate, if that happens, we will try to bring some classes back, and the preference or priority will be given to those 600 lab sections. Within those lab sections, some of those courses may come back. Now, let's assume if everything is working well, people are getting vaccinated, and the infection rate in county is very low, and we move to low moderate level. At that time, we will try to bring more classes back. Again, first giving priority to those 600 lab sections. Now, suppose things get really, really good, and we are in low or pretty much neutralized level. At that time, we will plan for majority return to in-person learning.
Wonderful. Thank you, Sanjay. Let me go to the next question that I've received, a video question from Asia Byers.
Will class sizes shrink in order to accommodate for social distancing? And if so, what will the max class size be?
Thank you, Asia, for that question. Let me tag team both Dr. I and Ms. Schena to respond to that, because I think it's a combination around the physical capacity for classes as well as just a guiding philosophy about that. Ms. Schena, would you like to go first?
Sure. As we've talked earlier, we really hold up the CDC guidance into how we bring people onto our facilities. So as long as social distancing standards are in effect, we will still have to limit the number of students and employees in a space based on those standards. The maximum size depends on the size of the space, the classroom. And our classrooms are all not the same, and they have varying activities. So we will be looking at those kinds of things individually. A class may have the same number of students, but some may be on site and others may be remote learning. I was just in a meeting this morning talking about flex space on our campuses and how we can leverage technology to accommodate a class where we can have students in the classroom and students taking that class at the same time remotely. So we're looking at things in a very innovative way in how to be able to accommodate all of the students who will want to attend Montgomery College.
Wonderful. Dr. Rye, anything you want to add to that?
I think Donna answered that quite well. We will follow the social distancing protocols. While class size may not change, but number of students attending classes in person, we will follow the social distancing protocols of the region.
Wonderful. So we have a two-part question. And the first part of this, I'm going to ask you to take, Dr. Brown, and it's from Jeremy Liginelli, and he asks, my main concern is for the international students. How does this impact them moving forward? Students with an F1 visa or want to come and attend our college. As of now, they can have one online course and several remote. What happens if the college does one thing and the government says another? For example, we have our options in the summer and fall, but the government says they must attend only on campus classes. That almost happened last summer with the former administration. Dr. Brown?
Yes, thank you, Dr. Pollard, and thank you, Jeremy, for the question. We are following the Student Exchange and Visitor Program guidance that was established in August 2020. So the current temporary regulations allow F1 students to enroll in remote online classes as full-time. We are still waiting for guidance for the fall 2021 fall semester and beyond from the federal government, and will comply with that guidance.
Thank you. So again, there is an amount of variables that we have to respond to, which I think is a consistent theme you're going to hear in a lot of these questions. You know, we had a meeting a couple weeks ago, and I told them I'd had an epiphany that for a large part of this pandemic, we've had the ability to really manage our response internally. And we've been able to do that based on the autonomy that we have as an organization, that the Board of Trustees does as an appointed governance body for this institution. But now, as we're thinking about the return, all of these things are far more difficult because we are trying to respond to the number of other entities that get to influence or have impact on the decision making that we may make as an institution. So that's a thing you're going to hear constantly throughout, and I really appreciate you giving us an opportunity to raise up that point. Jeremy's second question deals with on-campus services. What would be the metrics for returning to campus for services like writing centers or computer labs? I know some of the buildings are older than others and may not have the services or the HVAC to deal with the current pandemic settings. What kind of assurances will the college provide in those cases? For instance, Rockville has newer writing centers with proper ventilation. However, I know that TPSS, the writing centers in the basement of the library, that has always had issues with air quality even before the pandemic. Donna, I'll let you take this question, and then I'll see if any of our other colleagues want to chime in on it.
Jeremy, great question, and one where there is significant attention being paid. Heating, ventilation, and air conditioning systems are very complex systems to operate. These systems always require oversight and attention in how they are operating. They are key to air quality in our buildings. Our facilities leadership is acutely aware of the transmission challenges of this virus and the important role of HVAC systems in ensuring proper air quality. Our buildings have always been built and maintained according to the contemporary building standards for airflow at the time they were built. Our newer buildings meet today's highest standards through our mandate to build LEED certified buildings. LEED stands for Leadership in Energy and Environmental Design. And it certifies that a building is a green building, that it's healthy, highly efficient, and creates cost savings. It's a globally recognized symbol of sustainability and achievement in leadership. But given the transmissibility concerns that COVID presents, the industry guidance is to have a system that operates at a MERV 13 rating, and I'll explain what that means. MERV stands for Minimum Efficiency Reporting Value. Air filters used in HVAC systems are rated according to the MERV standard. The ratings indicate the size of particulate matter that the filter can remove from the air. The higher the MERV rating, the smaller the particulate matter it can trap. It is not always as simple as replacing a lower MERV rated filter with a higher, because a higher MERV rated filter requires more powerful fans to pull the air through a more robust HVAC system. And that system includes motors and fans, the ducting that we pull through buildings, and the controls. So the filter has to work within the entire system. Our engineers can manage to a certain extent the operation of the equipment to address some of these challenges. However, as you've indicated, the age of the equipment, we have older buildings and older systems, and the age can present challenges as well. And what we have done just recently is completed an assessment of all the HVAC systems in our buildings on our campuses. And as I said, our newer buildings are MERV 13 because they are LEED certified. For those that cannot be easily upgraded to the MERV 13 filtration level, our facility staff are researching other filtration techniques based on industry standards as designated by an organization called ASHRAE, and that is the American Society of Heating, Refrigerating, and Air Conditioning Engineers. But I want to be very, very clear. We will not open buildings for occupancy that we cannot ensure safe air quality.
That is the line that I think is most important, Donna, that everyone wants to hear. I love the explanation, but this idea that we will not open buildings. So obviously, Dr. Wright, that may have some implications for service delivery. Anything you want to add to that before we go to the next question?
Yes, thank you, Dr. Pollard. Certainly, whether it's learning center or writing center or anything else, we'll come back to campus only when it is safe, and we will follow all the standard guidelines. But learning centers have done an amazing job in switching to remote support to students. Students are availing these services, students are doing well in their classes, and they have done also a great job in providing these academic support to students on evening and weekends. So learning center folks are ready to offer their services in online environment for summer and also for the fall semester.
I've heard some great stories from students about how responsive those services have been, and particularly delivering them in a virtual environment has been very useful to them, adapting their schedule. So I appreciate that. Thank you, Dr. Wright and Ms. Schena. I'm going to go to the next question, which is a video question that I have from Miguel Rodriguez.
Where is Montgomery College actually getting their instructions for reopening from? Is it more local MC County officials, or is it the larger government of Maryland State? I know the governor of Maryland has instructed schools to open, and I know certain states and counties across the U.S. have been opened, but it seems, especially when you look at indoor dining and movie theaters, for example, that Montgomery County in particular is strict when it comes to staying locked down. So if Montgomery College doesn't follow Governor Hogan and only more local officials, if that is the case, then how much influence does the governor actually have on this process?
Thank you, Miguel, for that question. And I just as I thought about and listened to your response, the first thing is that, as you indicated, the governor indicated that schools should be open, and that speaks to the K-12 space. very important distinction between K-12 and higher education. Montgomery College makes its own decisions about opening or limiting activity and do that under the authority of the Maryland Code, but also through the governance of our Board of Trustees. We're not directed by the governor. We certainly can receive feedback and encouragement, and at some level, some ideas about how they can support us. But we will always also comply with any state or countywide directives about public health that are issued by the Departments of Health and Human Services. As I talked about this at the beginning, we've been using a list of metrics to assess how safe the campuses are and how our work sites should be once we return to in-campus or in-building work. And those assessments may be different from what the governor decides for other institutions or the county decides about MCPS, our K-12 partners. So if you see MC making decisions differently than other systems, take a minute to think about how our metrics may be different than other regions. Infection rates in Montgomery County, for example, have been much higher at different times during the pandemic than other areas. And as an institution, our classrooms are designed to put many people close together. So we might decide not to host many in-person learning experiences. Another college in a different area may have to make or may choose to make a different decision based on their local metrics. So I really appreciate that question, because I think a lot of it is to understand the nuances in terms of authority, and that's a very thoughtful question. Now, we also had a second question from Miguel.
I recall small businesses like restaurants being allowed to open for a short time, and then they were locked back down again when reports of rising COVID cases started. Would this happen if students are back on campus this fall or next spring? Or will there be a fail-safe where when we're finally back on campus, we can depend on staying on campus?
Thank you for that. I'm sure you can understand that the college has to reserve the right to backtrack if we need to. We're talking about people's health, both our students and employees, and that has to be our top priority. In fact, we've seen some of our peer institutions most recently have to do this after what they saw as a spike in COVID cases on their campus. I wish that we can say that there was a magic solution out there that's 100% effective, but that's not the case. We wouldn't have been, to a certain extent, shut down as a globe for the last year. But what I will say is that there are metrics that we do have some control over. Vaccinations when they're more widely available, and practicing good health protocols, which will have a significant impact on the health of our community. So I would encourage you to really focus on what we can control, keeping yourself and your family safe, with the caveat that we know that this is bigger than all of us put together. I do want to comment, you used the term fail-safe, which I think comes from engineering, and it refers to features that protect a system from total failure. In our case, I would say that a really robust teaching apparatus means that students who might have to revert to a remote class can do so easily and step into classrooms where faculty are well trained and equipped. This is something that we didn't have in place last year, this time we had to go into the emergency remote instruction. We are all using the same remote platforms. Our faculty have had deep training in this space, and they have robust supports. So we have given a lot of funding and thought as an institution that has helped our students get technology that can keep them connected in the event that we have to take a step back. And of course, we're being very careful in our advances, so it is less likely that we have to retreat. I am of the opinion that I believe and prefer a cautious approach that allows us to have incremental change in this space, because we are talking about people's lives. So I really appreciate your question, Miguel, and look forward to meeting you in person sometime. Dr. Wright, I'm going to ask you to take the next question that we have from Iman Sherbajian, and this question came in. It says, as you know, or we know, some classes can function well both in person and online. I'm wondering how you plan to address these classes post-pandemic. Do you think online classes in some fields like English or communications will be offered mostly online or in person?
Well, thank you, Iman. Thank you, Dr. Pollard. We have started thinking about how we offer our classes in the post-pandemic environment. What I want to make it very clear that while some courses are hard to teach in online environment, some courses are slightly easier to teach in online environment. But we also need to understand that some students learn better in face-to-face environment and some students learn better in online environment. So what we will do going forward, we will provide that flexibility to all our students. Students who prefer face-to-face classes will have those classes available for them. Students who prefer to take their classes in distance format or in structured remote format, we will make sure that they have that option available as well.
Very good. Thank you, Dr. Rai. I have my next question is actually another video question from a Joseph Smithy.
I'm wondering if when we return to campus, students who are in the TVRA program, a program that requires access to the television studio and the radio station for certain classes, when we return to campus, will those students have the opportunity to gain that experience in those locations to make up for anything that may have been missed out on during the period of remote learning?
That's a really great question. I'm going to ask let me see, actually, Ms. Schena, do you want to take it first, and then maybe we'll tag in Dr. Rai as well?
Joseph, and thank you for that question. It's a two-part question. It's an academic question regarding content and an operations question regarding access to the studio and the radio station. So how and when a course is completed is an academic matter, but I'll address the operational part. It's the responsibility of our facilities leadership to ensure our buildings and campus environments are practicing the necessary health and safety protocols recommended by the CDC. I spoke a little bit earlier about the HVAC system and the work that's going on in that area to determine the quality of our air in those buildings and ensuring that when we open a building, it has the appropriate air quality. It's one of our facility staff has always taken seriously, even pre-pandemic. But once the college has a specific timeline and process to increase our on-site presence, our facilities teams will ensure all areas will be appropriately and routine disinfected. Social distancing, mask wearing will be required until the CDC guidance determines otherwise. So it will be phased. Dr. Rai, is there anything you want to address about the academic?
Sure, certainly. I think, Joseph, your question is that for students who are taking some of these hands-on classes in remote format, once they finish their courses, and assuming, pandemic level is very low or has disappeared, you're asking whether those students can come back to campus and gain some learning or some experience in those areas. We haven't thought about that, but it's a very good suggestion, and I'll take it back to deans and department chairs and see what we can do. Again, Ms. Shena's advice is an important one. Once things are completely normal, we have access to all our facilities, then at that time, we can certainly see what can be done for those students.
Thank you. That's a great question and thoughtfulness in terms of helping us think about that. Let me go to the next question. Mr. Sears, I'm going to tag you in here in a moment after I read the question that came in from Kenneth Wainaina. I'm sure I mispronounced that, but I apologize. Is it possible to have a physical graduation ceremony safely on May 21st, 2021, under the guidance of COVID rules? Graduation is so precious and a significant milestone for someone like me, and I believe to other students as well. We all have friends and family that would like to attend this special day, but some have opted to cancel because it is being done virtually. This makes me very sad. What is the official position of Montgomery College regarding this issue?
Thank you, Dr. Pollard. I can answer that question. And thank you, Kenneth, for asking it, because so many students have this on their mind. Unfortunately, I'm going to have a virtual commencement ceremony this year. That is based on the recommendation of our CAT team and in the best interest of the health and safety of students, their families, and our employees. Last year, our MCTV team, along with our special event staff and commencement committee, did a phenomenal job of putting together a virtual ceremony that was meaningful and very student-centered and personal to those students that graduated in 2020. We look forward to doing more in 2021, so stay tuned. We'll have more information shortly about a virtual commencement for spring of 2021, and there'll be a few surprises for these graduates, so stay tuned.
Thank you, Dave. And I know that this is a meaningful ritual of higher ed, Kenneth, that so many of us celebrate. You often hear people describe commencement as the best day of the year at Montgomery College. But we also know that trying to bring together an event that typically hosts 5,000 people plus on the campus is just not something that's safe to do for students, families, or our community. So very thoughtful. Dave and his team have come up with some fantastic strategies to help, while it may be different, to still make it feel special for you. I have another video question that's coming in from Chineze Ara.
What sanitation measures will be put in place, especially in high traffic areas like the cafeteria?
Great question. Ms. Schena, you're on spot again today for this one.
Thank you. Hello, Chinese. Thanks for the question. Our return to campus will be a phased and gradual return. Therefore, areas that have been historically high traffic areas will not be initially, because we will be ensuring social distancing throughout all areas of our campuses and buildings, because we'll be doing a gradual return. However, regardless of that traffic level, we'll continue to have in place the cleaning protocols that we currently have in place. These protocols are in keeping with the standards established by the CDC, including the use of proper cleaning chemicals, proper cleaning procedures, and also frequency of cleaning. So as traffic increases, you're going to see more and more cleaning. Our employees and students will return, and they can expect to see staff moving routinely through our facilities, cleaning surfaces. And you'll also see, which is already in place, hand sanitizing stations throughout the building. I was on campus a few months ago, and it didn't matter which direction I turned, I could see a hand sanitizing station. And there's also lots of signage to ensure social distancing and help people keep their distance from one another with directional signaling as well as just reminders.
I concur. I was on campus, Ms. Schena, a couple of weeks ago as well, maybe a couple of months ago now, and I was struck by the abundance of the hand sanitizers and the abundance of the directions and the abundance of people who were cleaning. Literally every space I went into, before I arrived, after I arrived, there was cleaning taking place. And it's not just because I was a president. You can tell it was a routine pattern that they were going through. I have the next question as well that I'll ask you to take, Donna, from William Jones, who says, it is my understanding that facilities, building services were put on a 3-day work schedule to promote social distancing. Despite that, we still received almost weekly reports of coworkers testing positive, one of them being a member of my unit. With that in mind, what is the rationale for facilities at TP Tacoma Park campus going to a 4-day schedule? 3 days allow for 2 different groups of workers to be on campus without interacting. The additional day means that at least 1 day each week we'll have a full staff on campus or site, which will reduce our ability to social distance and increases opportunities to spread the virus. Other than money, we've got to be straining the admin leave budget. Why are we putting more people closer together?
Hello, William. Thank you. This is an excellent question, and it recognizes the changeable environment in which we have been living and working for the past year and will be for the immediate future. Each campus has been and will continue to be staffed based on the needs of that campus. We have small level of activities going on the campuses now, but we staff according to what is happening on those campuses. So the staffing levels will vary based on the demand and the differing activities on our campuses and in our buildings. Again, access to these facilities currently requires approval through the Corona Advisory Team. And this even means contractors that come on our campuses to do projects. They have to certify that they have Corona protocols in place as well. So we have contractors on campus. We have a new building going up at Tacoma Park. We have deferred maintenance projects that are taking place at this time, and they will make sure that we have the staffing level, our leadership will make sure that we have the staffing levels there to ensure the cleaning and disinfecting of areas where these individuals have been. They track it very closely. And so depending on the level of pre-approved activity, the staffing level will need to be adjusted periodically. And it's not going to be the same at each campus because each campus has different activities occurring. So as you said, there will be more staff on campus. It could come up and then it could be pulled back down. But it will mean an increase in our personal due diligence in what we are doing with our protective behaviors as we are engaging on the campus. And that's a very, very important thing. Dr. Pollard mentioned it at the beginning, is that we have to exercise that due diligence for ourselves. I shared earlier the number of positive cases that we've had. We monitor that, respond to that immediately as well. Facilities staff have received frequent COVID trainings, and they receive reminders to wear masks, to social distance, and to wash their hands frequently. And I would just say, if you see anything that concerns you, you should bring it to the attention of your supervisor. We know that our facility staff and our public safety staff were the earliest of staff that we started bringing back on campus because those jobs cannot be done remotely, and they're critically important jobs. So what we try to do is put in place the necessary preventions so that we don't put our employees in a challenging situation, but we also need the employees to do the same thing. It's important for all of us to be safe, that each of us has a responsibility to keep ourselves safe by adhering to these practices of mask wearing, hand washing, and social distancing.
Yeah, I really appreciate the response and the question, because I do think there are going to be some moving parts. And in fact, I know Dave and I were talking about this earlier, that oftentimes in the midst of this, we're going to be piloting some things and seeking feedback. We're going to be thinking about how we have to adapt to what may be happening on a campus right now, and some different strategies along the way. This is, Dave, if you don't mind, I'd be interested to hear some of our thinking about how we can solicit. And I think Donna mentioned that in her comment. If you have a direct concern, have that conversation with your supervisor and let us work through that. But there are some other things we have that we can put in place to help people, or that we have put in place to get feedback from people about things.
There's a number of things that students, staff, and faculty and administrators can do to provide that feedback that we need. We just had the recent survey, Your Voice, Your MC, which was a phenomenal way for people to give feedback and allow us to take that feedback and improve how we've been communicating with others. We've got the ability for people to go to governance councils to share their concerns, and those concerns get brought to the right administrators and leaders to be able to address those issues. So those are a couple different ways in which we can address concerns people have as we look forward to the future.
Yeah, thank you, Dave, for just letting me call you out of turn there, because I think it's just a really important point for us to be thinking about. One of the things that I think we've done an exceptional job at during this pandemic is trying to make sure that we are excellent communicators. And communicating means giving messages, but also means receiving messages. So I'm hopeful that we'll continue this even when we're not in the midst of a pandemic. Dr. Rye, I have a question from a student, Renee Staples, about her classes. And she says, will more classes be available with my major early childhood education throughout the summer? None of my courses was offered during the winter session, pushing back my degree timeline. I would like to know if more classes will be offered due to everything being online. Hope to hear from you soon, and have a great weekend. That's so sweet.
Renee, I'm very happy to tell you that we are offering early childhood classes in summer one. There are 4 courses that will be offered in summer one. We will also offer Education 136 in summer two. Your point about winter session, extended winter session, we started offering that just 3 years ago. And it wasn't planned to be a large set of offerings. We started 3 years ago, and we are very fortunate that we started that 5-week online session, and we were offering about 60 sections per year. But this past winter, we expanded that to about 160 sections. And I do recall 2 early childhood education courses offered in that session. They were Education 115 and 119. My suggestion to you will be that for summer classes, register as soon as the enrollment registration process starts. Make sure you talk to your counseling faculty or academic program faculty sooner. I think that would be helpful.
Excellent. Thank you, Dr. Rai. Now, we have a question that came in that's not COVID related or any related to anything about change in operations, but it's a very powerful one because in the midst of all the stuff that we have going related to COVID, there's still other things happening at the college. So I'm glad to see that people are paying attention to these important topics. And Donna, I'm going to come to you after I read the question. From Dan Rankin. For Montgomery College's FY21 Compensation Market Study, approximately 142 positions were chosen as, quote, benchmark jobs to help the college focus on salary compensation. Some of those positions are listed a few times at various tiers, such as 1, 2, or 3, while others are not. What process was used to determine which tiers would be included or left out? Ms. Schena.
Thank you, Dr. Pollard. Hi, Dan. Thanks for the question. I appreciate that we were able to include this in this conversation, excuse me, because this question does demonstrate that in addition to managing the impact of the pandemic on our college, that there was work that was planned to happen this year and college-wide initiatives that were planned to begin. And they're happening in spite of the pandemic. And so I'm really very proud that we're able to continue with a lot of this important work. The compensation study is an example of an initiative that was planned well before the pandemic hit us. This study, it's an important best practice to ensure that our compensation is aligned with the market and our employees are fairly compensated. The benchmark jobs that you speak of, Dan, are those that reflect MC's workforce that are easily matched to external salary surveys and have similar job responsibilities and requirements. A rigorous analysis was conducted to select those benchmark jobs that reflect a cross-section of the college's job families, job levels, organizations in the college like departments and units and areas, and bargaining status. Also considered in the benchmark jobs are jobs that were identified through the strategic workforce study and positions that were previously submitted to HR STEM for classification review. As a best practice, 50% of positions should be benchmarked when an employer conducts a compensation study. The college's study will exceed that best practice of 50%. Based on the established criteria, HR STEM has reviewed and assessed each job classification individually to produce a representative cross-section of Montgomery College jobs. Tiers are often based on those that are likely to have the most incumbents and as a result yield the most robust market data. For example, if a job hierarchy has 3 levels, the middle level is normally chosen because that's typically the level with the greatest number of staff. So as an example of a hierarchy, an accountant 1, an accountant 2, and an accountant 3. And typically it's that accountant 2 level, that middle tier, that has the most incumbents in it, and they'll select that one. Another consideration is to have a diverse representation of positions at all levels in the organization. And finally, in order to ensure our adherence to best practices, HR STEM's draft list of benchmark jobs was shared with the compensation consultants that we have with us right now at the college, called Siegel, and they further refined and finalized the documents. So we feel we have done a very robust job of analyzing what we need to benchmark out there, so it will help us as we move forward with this body of work. Thank you for the question.
Thank you, Ms. Schena, and I join her in thanking Mr. Rankin for the question as well. Very thoughtful. So we've reached near the end, and I want to ask my colleagues, just as that last question kind of hit upon something other than COVID and COVID-related topics, if there are any topics or subjects that are in your area that we may have skipped over, and things you just want to draw or elevate to people's attention, I want to give you a minute or so each to address that. And since you've been on a roll talking today because of the questions, I'm going to start with you, Ms. Schena, about administrative and fiscal services. Anything you'd like to amplify from your area?
Thanks, Dr. Pollard. I would ask our employees and our students to visit our website, Resilient MC. It is in the top banner of the college's front page web. There's a wealth of information on this site. It provides guidance to faculty, staff, students on what you need to know and how to access a myriad of services that are available at the college, particularly in this remote environment. It has guidance on all matters related to the health and safety of our students and employees, and it talks about vulnerable populations that we spoke a little bit about today. In fact, everything we talked about today, there is information related to the topic on MC Resilient. And lastly, you can read the dozens of communications that have been shared with the college community throughout the pandemic. I spent some time reviewing these communications and preparing for our conversation today. It was amazing to look back on what we have all done to ensure that we protect and preserve our employees and students and the important work that Montgomery College does. I was heartened reviewing these communications. They reminded me of the challenges we faced during the past year and how we came together as a community to work through these harsh realities. It reminded me how very proud I am of us, and personally, how proud I am to be a part of this great institution. I am MC proud.
Wow, that was awesome. Thank you, Ms. Schena. Let me visit now with Dr. Rai.
Thank you, Dr. Pollard. I have to tell you that I'm so proud of the work that college has done, our faculty, staff, and also students. We made early decisions. We decided to stay remote in fall semesters. And I was very curious about the student success data from the fall semester. It came out to be extremely well and very consistent with the previous fall semesters. So 76% of our students passed their courses in fall of 20, which is exactly same as fall of 2019 when we were not in the remote environment. A student evaluation for fall semester, again, they came out to be extremely good, and they speak very highly of dedication and commitment of our faculty to student success. Faculty engagement, student engagement in classes, student evaluation data says that more than 90% students either agreed or strongly agreed that faculty engaged them in their classes in a very meaningful way. This is why meaningful way. Why this is important? Because majority of our students were learning in online environment for the first time. Majority of our faculty were teaching in online environment for the first time. And given that the kind of data that we see in the student evaluation is absolutely amazing. And this year, because we were in the remote environment, Faculty Council added 5 additional questions to student evaluations. And those questions also measured issues related to online teaching, use of technology, use of learning management system tools, kind of things that were covered in our SRT, Faculty Professional Development in summer. I'm very happy to report that on those 5 questions, more than 90% of the students either strongly agreed or agreed with faculty's work in those areas. So again, it makes me so happy, so proud, and certainly very thankful to faculty, staff, and students. And I am MC proud.
Thank you, Dr. Rai. I'm going to turn to you, Mr. Sears, about your thoughts in this space, things that I did not cover.
Thank you, Dr. Pollard. First of all, I want to mention the outstanding collaboration on communications throughout the pandemic. Our faculty, our staff, the Office of Communications, MCTV, the President's Office, and my colleagues here today have done a phenomenal job of trying to reach our students and the college community with proactive communications and information. They've used multiple platforms, whether it's email, social media, phone calls, meetings, and even word of mouth, to make sure that news and information gets in hands very early. As great a job as we've done, we're always looking to improve. We're going to be looking at the chatbot functionality at the college and whether we can expand that for greater uses, along with the texting functionality that we have. In addition to that, we're going to be using more data that we receive from surveys, focus groups, to better inform our decision making as we look at communications. We've conducted exit surveys, the employee engagement survey. All of those provide valuable feedback and input into how we can improve the way in which we communicate. And given that today's theme is healthy people and safe spaces, I just want to note the importance of dialogue during this time. Across the college, there's been phenomenal dialogues, whether it's the Let's Talk series, the HR STEM support groups, the work of WDCE and community engagement to hold seminars in Amharic for the Amharic-speaking population. We've had a number of ways in which we've created opportunities for dialogue for our staff, for our community. And we need to do that to keep people mentally and emotionally happy during this time. Thank you so much.
And I bet I can say for you that you too are MC proud, Mr. Sears.
I am MC proud. Thank you.
I'm going to turn to Dr. Brown, who can bring us home as only that she can do in terms of talking about issues from her division that are important and she wants to leave us with. Dr. Brown.
Thank you, Dr. Pollard. I can't believe that it's been almost a year since we transitioned to remote work. And it has been a great stretch of our capacities. But we've learned a lot about ourselves and our students during this time. We've adapted our services to ensure that students continue to receive support in this remote environment. We explored and implemented creative, innovative, and effective student success practices during this time, to include moving to centralized operations, use of online chatbots, and expanded live chat in counseling and advising. And we will continue to offer remote appointments to serve students with disabilities. We will continue to offer online appointments, workshops, and assistance with FAFSAs and forms via Zoom in financial aid. And Raptor Central will continue to serve as the one-stop shop for admissions, enrollment, and visitor services. And as we've discovered, it's even more important now in the remote environment. And our student life area has done an outstanding job keeping students engaged through virtual leadership development programs and various online activities and events. And the Student Health and Wellness Center for Success will continue to offer support services for students during this time. So I just wanted to take this moment to lift up a couple of the ways in which we have engaged with students and provided support services for them in a remote environment. And there are many more other examples of how we have and will continue supporting students moving forward. We've learned a lot, and we will apply what we've learned to improve our services going forward. I continue to be incredibly MC proud and appreciative of the faculty and staff and how we've come together to support students during this time, not only in the Student Affairs Division, but across the college. I think we're all MC proud and will continue to be MC resilient. Thank you.
Well, let me thank you all to the senior vice presidents for participating and joining. And I know the deliberateness in which you take in preparing for the questions that come in and the message you want to convey. So thank you all so much for that. I also want to thank all of those of you who wrote questions and submitted them. Tremendously grateful to you as well. And for those student video questions, that was nice to have the break from the faces and voices that are here, but to see students and be reminded all the time about why we do the work. I also would like to thank my colleague, Dr. Megan Givens, who makes sure that we're all in line in this work, and certainly to our wonderful colleagues at MCTV who do a tremendous amount of work to make sure we're able to deliver this program thoughtfully and professionally to our colleagues. I want to tell you that I am MC proud, and I'm MC proud for a lot of reasons. I have been in awe of our faculty and our staff and our students and how they have demonstrated such tremendous resilience in the midst of some truly difficult situations. You all have been resilient in ways that so many of us may not have ever thought possible, and you've done it with diligence and commitment and hard work. And most of all, you've done it in a way that leaves us still delivering on this most profound mission that Montgomery County and the state of Maryland, and dare I say our country, needs us to deliver on. I'm MC proud because I've watched us adapt. I've watched us think deeply about how we do our work, and I've asked us to think deeply about what that looks like now and in the future. And you've responded intentionally and deliberately in ways that continue to make me grateful to be a part of this organization. I am MC proud because I work with people who care. They care about each other. And I'm also MC proud because we serve students who care, and we work with people who care about students. We listen to them and we honor their experiences so thoughtfully. I ask as we move into this next anniversary moment of COVID that each of us are taking care and grace and kindness as it relates to the work we do, the people with whom we work, and the students that we have the privilege of serving. We are truly an exceptional institution doing exceptional work in our community, and I'm grateful to you. As we continue to evolve and think about what this means for us, I hope that you stay connected to all of the formal and informal ways in which we'll be communicating about vaccine availability, about any variants that may arise, and know that we're all working together to design systems that best serve our students, our employees, and the community of which we are a part of, and to protect them. We are committed to open and intentional conversation, and I hope that if you have additional questions, that you send those to Kat at the public safety email that will be on your screen, publicsafety@montgomerycollege.edu. Most of all, I hope that you take care of yourself and that we take care of each other. I thank you all, and take care and be well.